Did you know that 80% of pancreatic cancer patients initially mistake their symptoms for something else? That unexplained weight loss might not be your metabolism. That nagging back pain isn't just from gardening too much. The mild digestive changes aren't just normal aging. These 8 subtle warning signs are frequently dismissed, often until it's too late. In the next few minutes, I'll show you exactly what these easily missed symptoms look like in real life, and when they warrant a conversation with your doctor. Understanding these quiet signals your body sends could make all the difference in catching this disease early. Silent nature of pancreatic cancer. Pancreatic cancer has earned its nickname as the silent killer for good reason. The pancreas sits deep in your abdomen, hidden behind your stomach. When cancer develops there, you can't feel a lump from the outside. You can't see any changes in a mirror. The pancreas just quietly continues doing its job until something goes very wrong. This cancer often grows for months or even years without causing any symptoms you'd notice right away. Your pancreas makes digestive enzymes and hormones like insulin, and it keeps working even when part of it isn't healthy anymore. Your body is amazingly adaptable, which is usually helpful. But in this case, it means the cancer has time to grow before you feel anything unusual. Think about other cancers for a moment. Skin cancer shows up as a visible spot. Breast cancer might cause a lump you can feel. Colon cancer often causes bleeding you can see. But pancreatic cancer? It hides. By the time it causes symptoms obvious enough to worry about, the cancer has often spread outside the pancreas. This is why the numbers are so concerning. Only about 11% of people with pancreatic cancer survive 5 years after diagnosis. That's a hard number to hear, I know. But it's not because treatments don't work. It's mainly because most cases are found too late. Research shows that about 80% of pancreatic tumors are unresectable at diagnosis, meaning they can't be surgically removed because the cancer has already spread. But here's the hopeful part. When pancreatic cancer is caught early, before it spreads, the 5-year survival rate jumps from 11% to over 40%. That's still not as high as we'd like, but it's a huge improvement. Some patients who have successful surgery for early pancreatic cancer live many years beyond that. Early detection truly makes a difference. Let me tell you about Sarah. She's 67 years old and lives in Ohio with her husband. She gardens, visits her grandkids twice a month, and walks her dog every morning. About a year ago, Sarah started noticing small changes in how she felt. Her pants were a bit looser. She felt tired after lunch. Her stomach bothered her sometimes after eating. Her back ached a bit more than usual. The thing is, Sarah didn't connect these changes to each other. She thought her clothes were looser because her metabolism was changing with age. She blamed her tiredness on not sleeping well. The stomach discomfort? Probably that spicy food she ate. Back pain. Well, she did spend more time in the garden lately. Each symptom by itself seemed so normal, so everyday, that Sarah didn't think to mention them to her doctor for several months. When she finally did, her doctor listened carefully and noticed a pattern that Sarah herself hadn't seen. That led to tests that found a tumor in her pancreas. Sarah's story isn't unusual. Most people with early pancreatic cancer notice small changes but explain them away. They attribute them to age, stress, diet, or other normal life factors. It's completely understandable. These symptoms are subtle and easy to dismiss. But Sarah's story can help us. By learning which small changes might actually be warning signs, you can recognize patterns that might otherwise be missed. The signs often appear as a constellation, not just one symptom, but several small changes happening over a few months. I want to be clear about something. Having these symptoms doesn't mean you have pancreatic cancer. Most people with occasional stomach pain or fatigue don't have cancer. These symptoms are common and usually caused by much less serious conditions. But when several of these symptoms show up together, especially if they're new and getting worse, it's worth talking to your doctor. Pancreatic cancer research has shown that many patients report having certain symptoms for months before their diagnosis. When doctors reviewed their medical records, they found that these patients often mentioned these symptoms to their doctors. but neither the patient nor the doctor connected the dots right away. That's why knowing these warning signs matters so much. Understanding these subtle signs could literally save your life. That's not an exaggeration. Pancreatic cancer grows undetected, but it does whisper early warnings if you know what to listen for. The key to catching it early is recognizing those whispers before they become shouts. In Sarah's case, her early diagnosis meant she could have surgery to remove the tumor before it spread. Not everyone with pancreatic cancer can have surgery. It depends on where exactly the tumor is located and whether it has spread. But finding it early opens up more treatment options and gives your body the best chance to fight. Some researchers are working on better early detection tests for pancreatic cancer, especially for people with higher risk due to family history or certain genetic conditions. But for most people, being aware of these subtle symptoms is still the best early warning system we have right now. The 8 warning signs I'm about to share with you are the most commonly reported early symptoms. Pay special attention if you notice more than one of these happening at the same time, especially if they're new for you and getting worse over time. Remember as I go through these signs that any one of them can be caused by many different things. Having one symptom doesn't mean you have cancer. But knowledge is power, and knowing when to talk to your doctor about these symptoms could make all the difference. Let's look at the first warning sign that Sarah and many others dismiss: unexplained weight loss. What might seem like a pleasant surprise could actually be your body sending an important message. Unexplained weight loss. When dropping pounds isn't good news. The first warning sign we need to talk about is losing weight without trying. Many people would celebrate this unexpected change, and that's exactly what happened to Sarah. Around 9 months before her diagnosis, Sarah noticed her clothes fitting looser. Her favorite pants needed a belt. Her dresses hung a bit more loosely around her waist. At first, she was pleased. Sarah had always watched her weight, and suddenly dropping a few pounds without effort seemed like a gift. "I thought my metabolism must be changing," Sarah told her doctor later. "I figured maybe my daily walks were finally paying off, or maybe it was just one of those things that happens as you get older." She even mentioned it to her daughter during a phone call, joking that she might need to go shopping for new clothes soon. Her daughter congratulated her. Neither of them saw it as a warning sign. Why would they? Losing weight without effort sounds like something to celebrate, not worry about. Over the next few months, Sarah lost about 15 pounds without changing her diet or exercise habits. She didn't connect this weight loss with the mild stomach discomfort she sometimes felt after eating. She didn't link it to feeling tired more often. Each symptom seemed separate and explainable on its own. This is why unexplained weight loss can be so tricky. It feels positive at first. Who doesn't want to lose a few pounds? But weight loss without trying can actually be your body sending you an important message. Here's what happens. Your pancreas makes enzymes that help break down the food you eat. These enzymes flow through a small duct into your small intestine, where they help digest fats, proteins, and carbohydrates. When pancreatic cancer develops, it can block these enzymes from reaching your intestine. Without enough digestive enzymes, your body can't absorb nutrients properly from food. The food passes through your system without being fully digested. This means you're not getting all the calories and nutrients from what you eat, even though you're eating the same amount of food as before. Your body notices this problem and tries to make up for it. It starts burning more calories than usual. It might even break down muscle tissue for energy. All of this leads to weight loss, even though you haven't changed your eating or exercise habits. What makes this weight loss different from healthy weight loss? First, the timing matters. Doctors consider weight loss significant when you lose 5 to 10% of your body weight over 6 months without trying. For someone who weighs 180 pounds, that's about 9 to 18 pounds. Second, it happens without changes to your diet or exercise routine. If you've recently started eating less or exercising more, weight loss makes sense. But if your habits haven't changed and you're still losing weight, that's worth attention. Third, unexplained weight loss often happens alongside other subtle symptoms. By itself, losing a few pounds might not be concerning. But when it happens along with stomach discomfort, changes in bowel habits, or unusual fatigue, the combination becomes more meaningful. I want to be clear about something important. Unexplained weight loss doesn't automatically mean you have pancreatic cancer. Many other conditions can cause weight loss, from thyroid problems to depression to digestive disorders. Most people who experience unexplained weight loss don't have pancreatic cancer. But doctors agree on one thing. Unexplained weight loss should always prompt a conversation with your doctor. It's a signal that something in your body has changed. Sometimes that change is temporary or harmless. Sometimes it points to a condition that needs treatment. Either way, it's worth checking. When should you talk to your doctor about weight loss? Here's what medical experts recommend. If you've lost 5% or more of your weight over 6 to 12 months without trying. If your weight loss happens alongside other new symptoms. If you've lost your appetite or feel full quickly when eating. If you're over 60 and notice unexplained weight loss. Your doctor might ask questions about your eating habits, stress levels, and other symptoms. They might check for common causes like thyroid problems or medication side effects. Sometimes they'll recommend blood tests or other screenings to look for less obvious causes. In Sarah's case, her weight loss continued over several months. She lost about 15 pounds in total before her diagnosis. Looking back, she realized this weight loss happened around the same time she started feeling mild pain in her upper abdomen and back. She also noticed feeling less hungry at mealtimes. The weight loss wasn't dramatic enough to scare her. It didn't happen all at once. Instead, it was gradual, a pound or two each month. This slow pace made it easy to explain away or even celebrate. But combined with her other symptoms, it was actually an important clue about what was happening in her body. The American Cancer Society notes that unintended weight loss is a common symptom in people with pancreatic cancer. Studies show that many pancreatic cancer patients report weight loss in the months before their diagnosis. This makes it one of the most important early warning signs to watch for. When Sarah finally mentioned her weight loss to her doctor, along with her stomach discomfort and fatigue, her doctor recognized that these symptoms together might signal something more serious than separate minor issues. This led to the tests that eventually found her pancreatic cancer. Remember, unexplained weight loss of 5 to 10% of your body weight over 6 months should always be discussed with your doctor, especially if you're over 60 or have other new symptoms. It might be nothing serious, but it's always worth checking. Your body might be trying to tell you something important. But weight loss wasn't the only sign Sarah dismissed. As her clothes grew looser, she also began noticing occasional discomfort in her upper abdomen. Clinical studies describe it as a deep ache beneath your ribs, sometimes wrapping around to your back. This discomfort was another subtle sign that Sarah initially attributed to something else entirely. Mild abdominal discomfort. More than just age or indigestion, let's examine the second warning sign that often gets overlooked, abdominal discomfort that's easy to dismiss as nothing serious. What if that nagging stomach discomfort isn't just from something you ate? We all get stomach aches sometimes. Maybe it was the spicy food from dinner, or maybe you're just stressed. But sometimes, that mild pain could be telling you something important. As Sarah went about her daily life, she started noticing occasional pain in her upper abdomen. It wasn't terrible pain, just a dull ache that came and went. Sometimes she felt it right after eating. Other times it woke her up at night. The pain sat high in her stomach, just below her ribs. I figured it was just part of getting older, Sarah told her doctor later. My mother always complained about her stomach as she aged, so I thought it was normal. When the pain continued for a few weeks, Sarah started blaming certain foods. Maybe it was the tomato sauce. Maybe coffee was finally catching up with her. She even tried taking antacids, thinking it might be heartburn or indigestion. The problem is, Sarah didn't know where her pancreas was located or how pancreatic cancer might feel in its early stages. Most people don't. Your pancreas sits deep in your abdomen, behind your stomach and in front of your spine. It's surrounded by many other organs, which makes pain from pancreatic problems easy to mistake for other issues. When a tumor grows in the pancreas, it can press against nearby organs. It can also affect the nerves around the pancreas. This pressure creates a specific type of discomfort. According to the American Cancer Society, pancreatic cancer pain is often described as a deep ache beneath your ribs, sometimes wrapping around to your back. Many patients describe it as discomfort that encircles their body like a belt. This isn't the sharp, intense pain you might feel with something like appendicitis or a kidney stone. It's not the burning sensation of heartburn either. Instead, it's often a persistent, achy feeling that doesn't go away completely even when you change position or take over-the-counter pain medicine. The Pancreatic Cancer Action Network explains that this pain happens because the tumor is pushing against or invading nerves or organs near the pancreas. This pressure creates the dull ache that many patients describe. Of course, many other things can cause stomach discomfort. Gas, constipation, acid reflux, and even muscle strain can all create pain in your abdomen. Most stomach aches are completely harmless and go away on their own. That's why this symptom is so often dismissed. But there are some differences worth noting. Indigestion usually feels better after taking antacids. Food sensitivities typically cause pain only after eating certain foods. Muscle strain usually hurts more when you move in certain ways. The pain from pancreatic cancer, however, tends to persist regardless of what you do. It might get better or worse at times, but it doesn't completely go away. What's particularly important is how the pain pattern changes over time. In the early stages, the discomfort might be mild and occasional. You might only notice it after eating, or when you lie down at night. But as weeks or months pass, the pattern often changes. The pain might last longer. It might happen more frequently. It might gradually become more intense. For Sarah, the stomach discomfort started as an occasional nuisance. But over a few months, she noticed it was happening more often. She also began to notice that the pain sometimes spread to her mid-back, especially after eating larger meals. Even then, she didn't think it was serious enough to mention to her doctor right away. The pain wasn't terrible, she explained. It wasn't like I was doubled over. It was just there, nagging at me. I kept thinking it would go away on its own. This is why connecting the dots between different symptoms becomes so important. On its own, mild stomach discomfort probably isn't cause for alarm. But when it happens alongside other symptoms like unexplained weight loss, changes in digestion, or unusual fatigue, the combination becomes more meaningful. The location of the pain can also provide important clues. Pancreatic cancer often causes pain in the upper middle part of the abdomen, just below where your ribs meet in the center. Sometimes this pain radiates to the middle of the back. The McLeod Health blog points out that abdominal or back pain is a common symptom of pancreatic cancer, though the early symptoms are often vague. Some patients describe the pain as feeling deeper inside their body compared to more common stomach problems. This makes sense given the location of the pancreas deep within your abdomen. The pain might also feel worse after eating or when lying down, as these actions can increase pressure on the pancreas. What makes this symptom especially tricky is that the pain might not appear early if the cancer starts in certain parts of the pancreas. The American Cancer Society explains that cancers that start in the head of the pancreas can press on the common bile duct, causing symptoms like jaundice fairly early. But cancers in the body or tail of the pancreas may not press on the duct until they have spread, making early detection more challenging. This is why persistent mild stomach discomfort, especially if it radiates to your back, deserves medical attention. Your doctor might suggest tests to check your pancreas if the pain has lasted more than a few weeks and doesn't have a clear cause. When you talk to your doctor about stomach pain, be specific about where exactly you feel it, when it happens, and whether it spreads to your back. Also mention any other symptoms you've been experiencing, even if they seem unrelated. Sometimes the connection between symptoms only becomes clear when they're all considered together. Remember that most stomach discomfort isn't caused by pancreatic cancer. Many more common and less serious conditions can cause similar pain. But if the discomfort persists for more than a few weeks, especially if it radiates to your back and occurs alongside other symptoms we're discussing, it's worth having a conversation with your doctor. As Sarah's discomfort continued, she began noticing something else changing too, the way her body processed food. Foods she'd enjoyed her whole life suddenly seemed to cause problems, adding another piece to the puzzle she hadn't yet connected. Digestive changes. When your system starts working differently. The third warning sign involves changes in how your body processes food. These subtle shifts in digestion can be easy to overlook, but they offer important clues about what's happening inside your body. Have you noticed your food doesn't seem to digest the same way it used to? Most of us have occasional stomach troubles, but when your digestion changes and stays different, your body might be trying to tell you something important. For Sarah, these changes started gradually. After meals, she would feel uncomfortably full and bloated. Sometimes her stomach made embarrassing gurgling sounds. She noticed more gas than usual, which made her feel self-conscious when visiting her grandchildren. "I just assumed my stomach was getting more sensitive with age," Sarah told her doctor later. "I started avoiding certain foods I thought might be causing the problem. First, I cut out broccoli and beans. Then I stopped eating dairy. I even tried one of those gluten-free diets my neighbor was talking about." Like many people, Sarah didn't realize these digestive changes could be connected to her other symptoms. She didn't know that her pancreas plays a crucial role in digestion. Your pancreas makes special enzymes that help break down the food you eat. These enzymes flow through a small tube called the pancreatic duct into your small intestine, where they mix with your food. When pancreatic cancer develops, it can block these enzymes from reaching your intestines. Without enough digestive enzymes, your body can't properly break down the fats, proteins, and carbohydrates in your food. This causes several noticeable changes in how your body handles food. One of the most telling signs is steatorrhea. This means fatty stools that might look different than usual. They often appear greasy or oily. They might float in the toilet bowl instead of sinking. Sometimes they're lighter in color than normal, pale, clay-colored, or grayish. They might also have a stronger, more unpleasant smell than usual. Sarah noticed changes in her bowel movements but felt too embarrassed to mention them, even to her doctor. She didn't know this was actually an important clue about what was happening inside her body. The floating stools happen because without enough pancreatic enzymes, your body can't break down fats properly. Research shows that greasy stools can be an early symptom of pancreatic problems. Besides changes in your bowel movements, you might notice other digestive issues. Many people with early pancreatic problems feel full quickly when eating, even if they've only had a few bites. This feeling of fullness happens because the growing tumor can press against your stomach or the first part of your small intestine. Some people also experience nausea, especially after eating. Sarah occasionally felt queasy after meals, but she blamed it on eating too quickly or trying new foods. The nausea wasn't severe enough to make her vomit, just uncomfortable enough to make eating less enjoyable. These digestive issues often worsen gradually over time. In the beginning, you might only notice them occasionally. Maybe after a particularly large meal or when you eat certain foods. But as weeks or months pass, the problems happen more frequently. Foods you once enjoyed without any trouble now cause discomfort every time you eat them. This slow progression makes these symptoms easy to miss or dismiss. You might try different home remedies or over-the-counter products. You might change your diet, avoiding foods you think are causing the problem. These changes might even help a little, making it even easier to ignore the underlying issue. What makes these symptoms particularly tricky is that they can be caused by many different conditions. Irritable bowel syndrome, food intolerances, gallbladder problems, and even stress can cause similar digestive issues. Most people with bloating, gas, or changes in bowel habits don't have pancreatic cancer. However, when these digestive changes happen alongside other symptoms like unexplained weight loss, mild abdominal pain that radiates to your back, or unusual fatigue, the combination becomes more significant. It's this pattern of multiple symptoms that offers important clues about what might be happening in your body. Sarah tried various approaches to manage her digestive problems. She took over-the-counter gas relief medications. She kept a food diary to track which foods seemed to cause problems. She drank more water and started taking walks after meals, hoping movement would help her digestion. Some days were better than others, she explained. But overall, my stomach just didn't seem to handle food the way it used to. Foods I'd eaten my whole life suddenly gave me trouble. The digestive enzymes your pancreas makes are essential for proper nutrition. When these enzymes are reduced, your body can't extract nutrients from food effectively. This contributes to weight loss and fatigue, creating a connected pattern of symptoms that all stem from the same underlying problem. For people with pancreatic cancer, these digestive issues often appear before diagnosis. Studies show that many patients report digestive changes in the months leading up to their diagnosis. Yet because these symptoms are common and usually caused by less serious conditions, they're frequently overlooked or attributed to diet, stress, or aging. Changes in how your body processes food, especially when combined with other symptoms we've discussed, warrant a conversation with your doctor. Your doctor might recommend tests to check how well your pancreas is functioning or look for other causes of your digestive problems. If you're experiencing new or worsening digestive issues, try keeping a simple symptom journal. Note what you eat, when digestive problems occur, and any other symptoms you notice. This information can help your doctor understand what's happening and decide which tests might be appropriate. Remember that most digestive issues aren't caused by pancreatic cancer. Many more common and less serious conditions can cause similar symptoms. But persistent changes in digestion that last more than a few weeks deserve medical attention, especially if they occur alongside other symptoms we're discussing. For Sarah, these digestive changes were happening at the same time as her unexplained weight loss and abdominal discomfort. Research indicates that a 5% to 10% unintentional weight loss combined with digestive changes should prompt medical evaluation. As these symptoms continued, Sarah began to notice something else. Loss of appetite in food was fading. When food loses its appeal, she once looked forward to no longer sign we need to discuss is a change that many people actually welcome at first, until they realize what it might mean. What happens when your favorite foods suddenly don't interest you anymore? When the chocolate cake you always loved seems unappealing, or when you find yourself skipping meals without even feeling hungry. For Sarah, this change happened so gradually she barely noticed it at first. A lifelong food enthusiast who enjoyed cooking for her family, she started finding herself less excited about mealtimes. The smell of her morning coffee, once her favorite part of waking up, didn't seem as appealing. Her husband's Sunday pot roast, a meal she had always looked forward to, now seemed like too much effort to eat. I just thought I was getting older and didn't need as much food, Sarah told her doctor later. My mother always said her appetite decreased as she aged, so I figured it was normal. Some days, Sarah would realize it was dinner time and she hadn't even eaten lunch yet. Food simply didn't interest her the way it once had. When her daughter noticed Sarah wasn't eating much during a family dinner, Sarah brushed it off. I'm just not very hungry these days. Work has been stressful, she explained. Her daughter accepted this answer, not realizing this change in appetite was actually connected to the other symptoms Sarah had been experiencing. What Sarah and her family didn't know was that pancreatic cancer can affect your appetite in several different ways. First, when a tumor grows in the pancreas, it can press against your stomach or the first part of your small intestine. This pressure can make you feel full even when you haven't eaten much. Second, cancer cells can release substances that directly affect your brain's appetite control center. These substances can trick your brain into thinking you're not hungry even when your body needs nutrition. This is part of a complex process called cancer cachexia, which includes both appetite loss and muscle wasting. Third, when your pancreas isn't working properly, your body can't digest food as effectively. This leads to uncomfortable fullness, bloating, or nausea after eating, which naturally makes you less interested in food. Over time, you might start avoiding meals simply to avoid the discomfort that follows. This loss of appetite often happens alongside the unexplained weight loss we talked about earlier. In fact, they're frequently connected. Research indicates that a 5% to 10% unintentional weight loss combined with reduced appetite should prompt medical evaluation. You lose weight partly because you're eating less, but also because your body isn't absorbing nutrients properly from what you do eat. It's a double problem that can lead to significant weight loss over time. What makes this symptom tricky is that appetite can fluctuate from day to day. You might have days when you feel somewhat hungry and eat normally. Then you might have days when food seems completely unappealing. This inconsistency makes it easy to dismiss the symptom, especially in the beginning. However, when tracked over weeks or months, a pattern often emerges. Many pancreatic cancer patients report a gradual decline in their interest in food. What starts as occasional meal skipping becomes more frequent. Foods you once enjoyed become less appealing. Smaller portions leave you feeling full. The change happens slowly enough that you might not notice how different your eating habits have become until someone points it out. For adults over 60, changes in appetite deserve special attention. While some decrease in appetite can occur with aging, significant changes aren't normal at any age. After 60, our metabolic reserves are lower, meaning we have less room for error when it comes to nutrition. Losing weight and muscle mass can happen more quickly and have more serious consequences for older adults. The American Cancer Society notes that unintended weight loss and poor appetite are frequently observed in individuals with pancreatic cancer. These symptoms often stem from the cancer's interference with the body's ability to digest food and absorb essential nutrients. The combination of reduced appetite and weight loss can seriously affect overall health and well-being. Research published in the medical journal BMJ Open found that intermittent symptoms, including changes in appetite, may precede a pancreatic cancer diagnosis. Patients often dismiss these symptoms because they come and go, leading to delayed medical attention. This highlights why we need to pay attention to appetite changes, even if they don't happen every day. As the Economic Times reports, loss of appetite is an easily ignored symptom of pancreatic cancer. Many people attribute their decreased interest in food to stress, aging, or other life circumstances. While these are indeed common causes of appetite changes, persistent loss of appetite deserves medical attention, especially when it occurs alongside other symptoms. For Sarah, her decreased appetite was happening at the same time as her unexplained weight loss, digestive changes, and mild abdominal discomfort. Together, these symptoms created a pattern that eventually became impossible to ignore. But even then, she didn't connect them to a possible pancreatic problem. Several months into these changes, Sarah went for her annual physical exam. She mentioned her decreased appetite almost as an afterthought when her doctor asked about any changes in her health. She didn't think it was important enough to discuss in detail. Fortunately, her doctor asked follow-up questions that revealed the other symptoms Sarah had been experiencing. A noticeable decrease in appetite that persists for more than 2 weeks should prompt a doctor's visit, especially after age 60. Your doctor might ask about other symptoms you're experiencing, your stress levels, any medications you're taking, and your overall health. They might recommend blood tests to check for common causes of appetite loss, including thyroid problems or vitamin deficiencies. It's important to remember that most appetite changes aren't caused by pancreatic cancer. Many more common and less serious conditions can affect your interest in food. Stress, depression, medication side effects, and minor infections are just a few of the many things that can temporarily reduce your appetite. Most appetite changes resolve on their own or have easily treatable causes. However, when appetite loss persists for more than 2 weeks, especially if it occurs alongside other symptoms we've discussed, it's worth having a conversation with your doctor. Sometimes a decreased appetite is the first symptom people notice, even before weight loss becomes apparent to others. As Sarah's appetite decreased, her doctor noticed something concerning in her routine blood work during her annual physical. Her blood sugar levels were elevated, despite Sarah having no previous history of diabetes. This unexpected finding added another piece to the puzzle that would eventually lead to her diagnosis. What Sarah didn't realize was that a sudden diagnosis of type 2 diabetes, especially in adults over age 50 without typical risk factors, can sometimes be a warning sign of something more serious. New onset diabetes. When sugar levels suddenly change. The fifth warning sign is particularly important because it can be easily overlooked, yet it might be the most actionable for early detection. Did you know that developing diabetes after age 50 could sometimes be more than just a common health condition? While diabetes affects millions of people, a new diagnosis later in life might occasionally signal something else happening in your body. During Sarah's annual checkup, her doctor ran routine blood tests. When the results came back, Sarah was surprised to learn her blood sugar levels were much higher than normal. Her doctor diagnosed her with type 2 diabetes. "I was completely shocked," Sarah told her family later. "No one in my family has diabetes. I've never been overweight. I've always been careful about what I eat." The diagnosis didn't make sense to her, but she accepted it as just another part of getting older. Her doctor prescribed medication to help control her blood sugar and recommended some dietary changes. Sarah followed these instructions carefully. She cut back on carbohydrates, stopped adding sugar to her coffee, and started checking her blood sugar levels regularly. What's interesting is that neither Sarah nor her doctor initially connected this new diabetes diagnosis to her other symptoms. The weight loss, the digestive changes, the decreased appetite, and the mild abdominal pain all seemed like separate issues. Her doctor treated each symptom individually, not yet seeing the pattern that connected them. This isn't unusual. Most doctors don't immediately think of pancreatic cancer when an older adult develops diabetes. And most people with new-onset diabetes don't have pancreatic cancer. But research has shown there's sometimes a connection worth knowing about. Your pancreas plays two crucial roles in your body. We've already talked about how it makes digestive enzymes that help break down food. But your pancreas has another job too. It makes hormones that control your blood sugar. The most important of these hormones is insulin. The pancreas contains special cells called beta cells that produce insulin. When you eat, your blood sugar rises, and these beta cells release insulin into your bloodstream. The insulin helps move sugar from your blood into your cells, where it's used for energy. This keeps your blood sugar levels in a healthy range. When pancreatic cancer develops, it can damage these insulin-producing beta cells. As the tumor grows, it can destroy more and more of these cells, reducing the amount of insulin your body makes. Without enough insulin, your blood sugar levels rise, leading to diabetes. Research has shown a concerning connection between new-onset diabetes and pancreatic cancer, especially in older adults. Studies indicate that up to 1% of new-onset diabetes in adults over 50 may signal pancreatic cancer. This is particularly true when diabetes appears suddenly in someone without the typical risk factors. The Pancreatic Cancer Action Network emphasizes that sudden onset type 2 diabetes in people age 50 or older may be an early symptom of pancreatic cancer, especially in those who maintain a normal body mass index, experience continuous weight loss, or have a family history of pancreatic cancer. Not all diabetes diagnoses are created equal when it comes to pancreatic cancer risk. Certain patterns are more concerning than others. Developing diabetes suddenly after age 50, especially without the typical risk factors for type 2 diabetes, deserves special attention. The typical risk factors for type 2 diabetes include being overweight or obese, having a family history of diabetes, not getting enough physical activity, and having high blood pressure. When someone develops diabetes without these risk factors, doctors might need to look more carefully at why. Another concerning pattern is diabetes that develops alongside unexplained weight loss. With typical type 2 diabetes, people are often overweight and may continue to gain weight. But when diabetes and weight loss happen together, especially in older adults, it's a combination worth investigating further. This differs from the more common development of type 2 diabetes, which usually happens gradually over many years. Typical type 2 diabetes often begins with insulin resistance, where your cells don't respond properly to insulin. Your pancreas tries to compensate by making more insulin. Over time, your pancreas can't keep up, and your blood sugar rises. In contrast, diabetes caused by pancreatic cancer often develops more quickly. The damage to insulin-producing cells can happen over months rather than years. Blood sugar levels may rise rapidly, leading to a diabetes diagnosis that seems to come out of nowhere. This connection between new-onset diabetes and pancreatic cancer is often missed as a warning sign for several reasons. First, diabetes is very common, especially in older adults. When a common condition appears, doctors don't automatically look for uncommon causes. Second, the other symptoms of early pancreatic cancer can be vague and easily attributed to the diabetes itself or to aging. Many people don't realize that diabetes can sometimes be a symptom of another condition rather than a disease on its own. When diabetes appears suddenly in older adulthood without the usual risk factors, it's worth asking why. Sometimes there's a simple explanation, but sometimes it's your body's way of signaling that something else is wrong. For Sarah, the diabetes diagnosis was initially treated as a separate health issue. She focused on managing her blood sugar and didn't connect it to her other symptoms. Her doctor prescribed medication, which helped control her blood sugar levels, but didn't address the underlying cause. If you develop diabetes after age 50, especially without risk factors like obesity or a family history of the disease, it's worth discussing additional testing with your doctor. This doesn't mean you should panic. Most people with new-onset diabetes don't have pancreatic cancer. But it's a conversation worth having, especially if you're experiencing other symptoms we've discussed. Your doctor might consider additional tests beyond those typically ordered for new diabetes patients. These might include imaging tests that can examine your pancreas more closely. The goal isn't to cause unnecessary worry, but to ensure nothing important is missed. According to the Mayo Clinic, a new diagnosis of diabetes or existing diabetes that's becoming more difficult to control can be a symptom of pancreatic cancer. This is because the cancer can destroy insulin-making cells in your pancreas, leading to diabetes. While adjusting to her diabetes diagnosis, Sarah began noticing something unusual with her skin. What started as occasional itchiness soon became persistent enough to disrupt her sleep, adding yet another puzzling symptom to her growing list of health concerns. Itchy skin. More than just dryness. The sixth warning sign involves a symptom many people dismiss as nothing serious, but it could be telling you something important about your health. What if that persistent itching isn't just dry skin or a reaction to your laundry detergent? Sometimes, itchy skin can be your body trying to tell you something more important. Several months into her health changes, Sarah started noticing itchy skin, especially on her arms and legs. At first, she blamed the winter weather. Michigan winters are notoriously dry, and she'd experienced winter itch before. She bought an expensive moisturizer from the department store and applied it faithfully every morning and night. "I thought it was just dry skin," Sarah told her doctor later. "I've always had sensitive skin, especially in winter." She tried everything she could think of. She changed her laundry detergent to a fragrance-free version. She stopped using scented soaps. She even ran a humidifier in her bedroom at night to add moisture to the air. But unlike normal dry skin, this itching didn't get better with any of her usual remedies. The expensive moisturizer that had worked in previous winters didn't help. The fragrance-free products didn't make a difference. Even the humidifier running all night didn't provide relief. What Sarah didn't know was that her itchy skin wasn't coming from the outside. It was coming from the inside. When pancreatic cancer grows in certain locations, it can press against or block the bile duct. This small, tube-like structure carries bile from your liver to your small intestine to help digest fats. When the bile duct becomes blocked, bile can't flow normally into your intestines. When bile duct blockage causes bilirubin to build up, your skin itches because bilirubin accumulates in your tissues. Many people don't realize that itching often precedes jaundice by weeks, appearing before the more well-known symptom of yellowing skin and eyes. This type of itching feels different from ordinary dry skin. It often feels like it's coming from deeper within your skin. People describe it as intense, persistent, and sometimes even worse at night. For Sarah, the itching was strong enough to wake her up from sleep sometimes, causing her to scratch until her skin was red and irritated. The location of the itching can also provide clues. While it can happen anywhere on your body, itching related to bilirubin buildup often affects the palms of your hands and the soles of your feet. Sarah noticed her palms itching frequently, which seemed strange to her. She'd never experienced itchy palms before, even during the driest winter months. Some people also experience itching all over their body, not just in specific areas. This widespread itching can be particularly distressing because it's hard to get relief. No matter how much you scratch, the itching continues because its cause is internal, not external. If left unchecked, this symptom often progresses in a specific way. The itching typically increases over time as bilirubin levels continue to rise. Eventually, the yellowing of the skin and eyes becomes visible. The condition known as jaundice. The whites of the eyes are usually the first place where yellowing becomes noticeable. What makes this symptom so tricky is how subtle it can be in the beginning. Many people experience occasional itchy skin for completely harmless reasons. Dry air, new skin products, or even stress can cause temporary itching. Most of the time, itchy skin is not a sign of something serious. But certain patterns of itching deserve more attention. Itching that doesn't respond to normal treatments, itching that gets progressively worse over time, or itching that concentrates on the palms and soles might be telling you something important about what's happening inside your body. For Sarah, the itching became just one more unexplained symptom to deal with. She bought anti-itch creams and took cool baths with colloidal oatmeal. She wore soft cotton clothing and avoided wool. She did everything she could think of to get relief, but the itching persisted. When Sarah finally mentioned the itching to her doctor, along with her other symptoms, it helped complete the clinical picture. Her doctor examined her skin carefully and checked the whites of her eyes for any subtle yellowing. While Sarah hadn't developed visible jaundice yet, the persistent itching, combined with her other symptoms, raised enough concern to order additional tests. Your skin is your largest organ, and it can often reflect what's happening inside your body. While most cases of itchy skin have simple causes, unexplained itching that doesn't respond to typical treatments deserves medical attention. This is especially true if the itching affects your hands and feet, or if it's accompanied by other unusual symptoms. When you talk to your doctor about persistent itching, be specific about when it started, where on your body it occurs, what makes it better or worse, and any other symptoms you've noticed. This information helps your doctor determine whether additional testing might be needed. Remember that most cases of itchy skin aren't caused by pancreatic cancer. Many more common and less serious conditions can cause similar symptoms. Dry skin, allergic reactions, eczema, and even stress can all lead to itching. Most itchy skin has a simple cause and an easy solution. However, when itching persists despite trying normal remedies, especially if it affects your palms and soles, it's worth having a conversation with your doctor. Your skin might be trying to tell you something important about your health. As the weeks passed, Sarah found herself struggling with more than just physical discomfort. Her energy seemed to be draining away, leaving her exhausted in a way she'd never experienced before. Even after a full night's sleep, she woke up feeling as if she hadn't rested at all. Persistent fatigue. When tiredness doesn't improve with rest. The seventh warning sign is a type of tiredness that feels completely different from ordinary exhaustion. What if your energy has disappeared in a way that doesn't make sense? We all feel tired sometimes, but there's a specific kind of fatigue that deserves special attention. For Sarah, the extreme tiredness became impossible to ignore. She first noticed she couldn't finish her gardening without sitting down several times to rest. Then she began taking afternoon naps, something she'd never needed before. Despite sleeping through the night, she woke up feeling completely unrest. "I just figured this was part of getting older," Sarah told her family. "My friend Martha said she started taking naps at 65, so I thought it was normal." Some days, Sarah would skip her morning walk with her dog because she simply didn't have the energy. Simple household tasks became major challenges. After her diabetes diagnosis, Sarah had another explanation for her tiredness. "My doctor said fatigue can be a symptom of diabetes, so I blamed it on that." She tried drinking more water and eating smaller, more frequent meals to keep her blood sugar steady. She even started going to bed earlier, hoping more sleep would help. But nothing worked. This wasn't ordinary tiredness that goes away after rest. What Sarah was experiencing was cancer-related fatigue. Cancer fatigue feels like deep exhaustion that sleep can't fix, often impacting daily activities. It's a whole-body weariness that makes even simple tasks feel overwhelming. Pancreatic cancer causes this distinctive fatigue in several ways. First, cancer cells consume a lot of your body's energy resources. They need nutrients to multiply, taking these nutrients from your healthy cells and leaving less energy for your normal activities. Second, your immune system recognizes the cancer as a threat and works hard to fight it. This immune response requires significant energy, contributing to your feeling of exhaustion. It's similar to how fighting an infection makes you feel tired, except this battle continues day after day. Third, cancer can trigger inflammation throughout your body. This inflammation affects how your cells produce and use energy, making everything require more effort than before. Your body simply can't convert food into energy as efficiently as it once did. For Sarah, this fatigue affected every aspect of her life. She couldn't concentrate on her favorite mystery novels. Phone conversations with friends became too exhausting. Even making a simple meal felt like running a marathon. "I used to have energy all day," Sarah told her doctor. "Now I feel completely drained after doing almost nothing." This dramatic drop in energy affected her mood too. She felt frustrated by her limitations and worried about becoming dependent on others. The fatigue Sarah experienced had a unique quality that distinguishes cancer-related fatigue from normal tiredness. It felt heavier, more physical, almost like wearing a weighted vest all day. It would sometimes arrive suddenly, forcing her to sit down immediately. It didn't follow a normal pattern related to activity or time of day. And most importantly, it didn't improve with rest. Many people describe cancer-related fatigue as feeling weak all over, or like moving through mud. For Sarah, it felt like carrying a heavy backpack up a steep hill. Everything required more effort than it should. This specific quality of fatigue is an important clue that something beyond normal tiredness might be happening. What makes this symptom challenging is how easily it blends with modern life. Everyone seems tired these days. Working parents, busy professionals, active retirees. Fatigue is practically expected. This makes it easy to dismiss even serious fatigue as just another part of a busy life. For Sarah, the fatigue was happening alongside all her other symptoms. The weight loss, the digestive changes, the mild abdominal pain, the itchy skin, and the new diabetes diagnosis. Together, these symptoms created a pattern that became increasingly difficult to ignore. After several months of worsening fatigue, Sarah finally mentioned it to her doctor during a follow-up appointment for her diabetes. "I just can't seem to get my energy back," she explained. "I've tried everything. More sleep, better food, vitamins. Nothing helps." Her doctor asked important follow-up questions. When did the fatigue start? Does it ever go away completely? How does it affect your daily activities? Has it gotten worse over time? These questions helped reveal that Sarah's fatigue wasn't responding to rest and was significantly affecting her quality of life. Fatigue that persists for more than 2 weeks and doesn't improve with rest warrants a conversation with your doctor. This is especially true if the fatigue seems out of proportion to your activity level or if it's affecting your ability to do things you enjoy. Your doctor might check for common causes like anemia, thyroid problems, or vitamin deficiencies. They might also consider whether any medications you're taking could be contributing to your fatigue. Remember that most cases of fatigue aren't caused by pancreatic cancer. Stress, poor sleep, depression, and many common medical conditions can all cause similar tiredness. Most fatigue has a simple explanation and straightforward solutions. But when fatigue persists despite your best efforts to address it, especially if it occurs alongside other symptoms we've discussed, it's worth having a conversation with your doctor. While dealing with this overwhelming fatigue and her other symptoms, Sarah began noticing something else. Changes in her bathroom habits that seemed unusual. One morning, she couldn't help but notice that something looked different when she used the bathroom. Changes in stool and urine color would finally lead her to seek the medical attention she needed. The 8th warning sign involves changes you might notice in the bathroom. Changes that are hard to ignore once you see them. Have you ever noticed your urine looking darker or your stool appearing different than usual? Most of us don't pay much attention to these things, but sometimes these changes can tell us important information about our health. One morning, about 8 months after her symptoms began, Sarah noticed something unusual. As she used the bathroom, she realized her urine looked much darker than normal, almost the color of strong tea or cola. She also noticed that her bowel movements had become lighter in color over the past week, a pale, clay-like color instead of the normal brown. That's odd, she thought to herself. Unlike her other symptoms, which she could easily explain away, these color changes seemed clearly abnormal. They didn't fit with her understanding of normal aging or the side effects of her new diabetes medication. Something felt wrong in a way she couldn't ignore. Sarah called her doctor that same morning. "I think I need to come in," she told the receptionist. "My urine is very dark, and my stools are almost gray." The receptionist scheduled her for an appointment that afternoon, much faster than her usual wait time for a non-emergency visit. This quick response confirmed Sarah's feeling that these changes warranted prompt attention. When she saw her doctor, Sarah described not only these new color changes but also reviewed all the symptoms she'd been experiencing over the past months. The weight loss, the stomach pain, the digestive issues, the decreased appetite, the fatigue, and the itching. For the first time, she connected all these symptoms as possibly related rather than separate minor issues. Her doctor listened carefully and explained why these color changes happen. Your liver makes a substance called bile, which contains a yellow-green pigment called bilirubin. Normally, bile travels through a small tube called the bile duct to reach your small intestine. There, it helps digest fats and gives stool its normal brown color. The pancreas sits right next to this bile duct. When pancreatic cancer grows in certain locations, it can press against or block this duct. When the bile duct gets blocked, bilirubin builds up in your bloodstream and eventually gets filtered into your urine, turning it dark. At the same time, without bile reaching your intestines, your stool loses its normal brown color. It becomes lighter, often described as clay-colored, pale, or gray. The specific colors to watch for, Sarah's doctor explained, are urine that looks like strong tea or cola, and stools that look clay-colored or gray instead of brown. These changes typically don't happen suddenly. They develop gradually as the blockage worsens. You might notice your urine getting progressively darker over days or weeks. Of course, other things can cause changes in urine and stool color too. Certain foods, medications, and supplements can temporarily affect these colors. Beets can turn urine reddish. Iron supplements can make stools look black. Dehydration can make urine appear darker. A number of less serious conditions like hepatitis, gallstones, or alcohol-related liver problems can also cause similar changes. But when these color changes persist for more than a day or two, especially if they're getting worse rather than better, they deserve medical attention. They could indicate a blockage that needs treatment, whether it's caused by cancer or something else. These visual changes are often later symptoms in the progression of pancreatic cancer. They typically appear after other, more subtle symptoms have been present for some time. That's why doctors consider them important warning signs. They're harder to ignore and often prompt the medical visits that lead to diagnosis. For Sarah, these noticeable changes finally led to the answers she needed. Her doctor ordered blood tests that same day, which showed elevated bilirubin levels. This led to imaging tests that revealed a mass in her pancreas pressing against a bile duct. A biopsy confirmed that Sarah had pancreatic cancer. While this diagnosis was frightening, Sarah felt relieved to finally understand what had been happening in her body. All the seemingly unrelated symptoms suddenly made sense as parts of one underlying condition. More importantly, finding the cause meant she could start appropriate treatment. Sarah's cancer was caught before it had spread beyond her pancreas. Because of this, she was able to have surgery to remove the tumor, followed by chemotherapy. Her treatment wasn't easy, but her outlook was much better than if she had waited longer to seek help. Her doctor explained that the color changes in her urine and stool actually helped save her life by prompting her to seek medical attention. If you ever notice clay-colored stools or dark urine like you described, that should always prompt immediate medical attention, her doctor told her. These changes often indicate a bile duct blockage that needs treatment right away. The visual nature of these changes makes them powerful warning signs. Unlike fatigue or mild pain, which can be subjective and easy to dismiss, changes in urine and stool color provide clear, visible evidence that something unusual is happening in your body. They're harder to explain away or attribute to normal aging, stress, or other common explanations. While most color changes have harmless causes and resolve quickly on their own, persistent changes, especially when they match the specific patterns described, dark urine and clay-colored stool together, should never be ignored. They deserve prompt medical attention, usually within a day or two of noticing them. For Sarah, these color changes were the final piece of the puzzle, the symptom that couldn't be ignored or explained away. They led directly to the tests that found her cancer and allowed her to start treatment while the disease was still manageable. Now that we've covered all 8 warning signs, unexplained weight loss, mild abdominal discomfort, digestive changes, loss of appetite, new onset diabetes, itchy skin, persistent fatigue, and changes in stool and urine color, let's talk about what you should do if you notice any of them. What simple step could make all the difference if you're experiencing these symptoms? Taking action. The conversation that could save your life. The most important action you can take is having a direct conversation with your doctor. For Sarah, it was a 10-minute appointment that finally led to her diagnosis. Let's look at how her story unfolded and what we can learn from it. After noticing the changes in her urine and stool color, Sarah called her doctor. During her appointment, she described not just these new symptoms but all the changes she'd been experiencing over the past 8 months. The weight loss, stomach pain, digestive issues, loss of appetite, new diabetes, itchy skin, and fatigue. "I wish I had connected these symptoms sooner," Sarah told her family afterward. "Each one by itself didn't seem worth mentioning. I explained them away or thought they were just part of getting older." Sarah's doctor ordered blood tests right away, followed by a CT scan. These tests showed a tumor in her pancreas that was pressing against her bile duct. Because she finally sought help when she noticed the color changes, doctors caught her cancer before it had spread beyond her pancreas. This meant Sarah was able to have surgery to remove the tumor, followed by chemotherapy. If Sarah had recognized the significance of her earlier symptoms, her journey might have been different. She might have received her diagnosis months sooner, when the tumor was smaller and easier to treat. Each month of delay gave the cancer more time to grow. This is why having a conversation with your doctor about multiple subtle symptoms is so important. Your doctor has the training to recognize patterns that might not be obvious to you. They can connect seemingly unrelated symptoms and determine whether additional testing is needed. But how exactly should you approach this conversation? Many people feel rushed during doctor visits or worry about seeming like a hypochondriac. Here's some helpful language you can use. "Doctor, I've noticed several changes in my health over the past few months that I'd like to discuss with you. I've been experiencing." List your specific symptoms. "These changes are new for me and seem to be getting worse over time. I'm concerned because these symptoms have been persistent." Be specific about when each symptom started, how often it occurs, and whether it's getting worse. For example, instead of saying, "I've been tired," try "Since March, I've been so exhausted that I need to rest after walking up the stairs," which never happened before. If you're concerned about pancreatic cancer specifically, perhaps because of a family history or because you've recognized several symptoms we've discussed, it's okay to say so directly. "I've read that these symptoms can sometimes be associated with pancreatic problems. Is that something we should look into?" If your doctor suspects pancreatic cancer might be a possibility, they might recommend several tests. Often, they'll start with blood tests to check your liver function, blood sugar levels, and sometimes tumor markers like CA19-9. While these tests can't diagnose pancreatic cancer on their own, they can provide clues about what might be happening. Imaging tests are usually the next step. These might include an abdominal ultrasound, CT scan, or MRI to get pictures of your pancreas and surrounding organs. A special test called an endoscopic ultrasound can provide very detailed images of the pancreas and allow for a tissue sample if needed. Sometimes, initial tests come back normal even when symptoms persist. If this happens to you, it's important to be persistent. You might say, I understand the tests are normal, but I'm still experiencing these symptoms. Should we consider additional testing, or is there a specialist you'd recommend I see? One helpful tool is keeping a symptom journal. For 2 weeks, write down each symptom you experience, noting when it happens, how long it lasts, whether anything makes it better or worse, and how it affects your daily activities. This detailed information can help your doctor see patterns more clearly. For example, Sarah could have noted that her stomach pain often happened about 30 minutes after eating and sometimes radiated to her back. She might have recorded that her fatigue was worse in the afternoons and not improved by napping. This specific information would have helped her doctor understand her symptoms better. Being your own health advocate doesn't mean diagnosing yourself or demanding specific tests. It simply means paying attention to your body, taking your symptoms seriously, and communicating clearly with your healthcare providers. No one knows your body better than you do. You know when something feels different or wrong. If you're experiencing symptoms that concern you, especially if they're persistent or getting worse, you have every right to discuss them with your doctor. You're not bothering anyone or wasting anyone's time by seeking answers about your health. That's what doctors are there for, to help you understand what's happening in your body and to find appropriate treatments when needed. A simple conversation with your doctor about multiple subtle symptoms could lead to earlier detection and better outcomes. If you notice 2 or more of these warning signs, especially if you're over 60, talk to your doctor. Early detection can quadruple survival odds. Most of the time, your symptoms will have a simple explanation. Perhaps a minor infection, a medication side effect, or a common condition like acid reflux. But sometimes, that conversation will lead to an important diagnosis that might otherwise have been missed or delayed. Sarah's story has a positive ending because she finally had that conversation. Her cancer was caught at a stage where treatment was still very effective. After surgery and chemotherapy, Sarah returned to gardening, walking her dog, and visiting her grandchildren. Her energy came back. Her appetite improved. She felt like herself again. I'm so grateful I finally talked to my doctor, Sarah says now. That one conversation changed everything. I just wish I'd had it sooner. Remember, the 8 warning signs we've discussed aren't meant to cause fear or anxiety. They're valuable information that can help you take control of your health and make informed decisions about when to seek medical advice. Knowing these warning signs empowers you to be proactive about your health. Armed with this information, you can have meaningful conversations with your doctor when something doesn't feel right. If you notice 2 or more of these warning signs, especially if you're over 60, talk to your doctor. Early detection can quadruple survival odds. Don't hesitate to speak up about changes in your body, even if they seem minor. Your doctor needs this information to help you. The difference between finding pancreatic cancer early versus late is significant. When caught before spreading, the 5-year survival rate jumps from 11% to over 40%. For the earliest stage, that number rises to 84%. Your health matters. When your body sends signals, respond with prompt medical attention.